Yes, it is. My name is Council Moyes, and I am the Chair of the Board of Health. The Board Secretary has confirmed that we have quorum, so I'll call meeting 20 of the Board of Health to order. Today's meeting is being held with board members and city staff participating by video conference only. This meeting is also being live streamed online at youtube.com/Toronto City Council Live. Because we're meeting remotely, we ask everyone for their patience with any delays and technical issues. If you are registered to speak at today's meeting, please listen for me to call your name. I will call speakers in the order they appear on the list. The list of speakers can be viewed online by visiting the Board of Health page at toronto.ca/council and clicking the speakers box for today's meeting. The Board Secretary has provided all agenda materials on toronto.ca/council and via CMP, the clerk's meeting portal. Directors, please keep your mic muted unless you wish to question staff or speak to an item and ensure that your video is turned on. As part of each agenda item, I will ask directors to raise their hand or unmute their mic if they wish to question staff or speak. I will then create a speakers list and will call on directors when it is their turn to speak. When voting on an item or motion, I ask that directors ensure that they turn on their video and to raise their hand to indicate their vote. Directors, I want to remind you that you must submit and approve your motions by email. Staff are available at boh@toronto.ca to help with motions. The Board of Health acknowledges that the land we are meeting on is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. The City of Toronto acknowledges all treaty peoples, including those who came here as settlers, as migrants, either in this generation or in generations past, and those of us who came here involuntarily, particularly those brought to these lands as a result of the transatlantic slave trade and slavery. We pay tribute to those ancestors of African origin and descent. Are there any declarations of interest under the Municipal Conflict of Interest Act? If you have an interest, please raise your hand or unmute your mic and indicate item number and the nature of the interest. Seeing none. Again, thank you for joining us on such short notice. I know we only put out the notice, I think, yesterday. Today, we have just one matter to attend to, as there has been an update on the Community Care and Recovery Act. As you may remember, the act, which will force the closure of at least 5 supervised consumption sites in Toronto, was officially passed earlier this month on December the 4th. Last week, the neighborhood group announced that they would be leading a legal challenge against the legislation, arguing that it would violate both the Charter of Rights and Freedoms and the Constitution. They hope to have a hearing at the Superior Court of Ontario ahead of the Act's implementation at the end of March 2025. This announcement has presented us with another opportunity to express our support for safe consumption sites. Toronto Public Health and our Medical Office of Health have a strong body of evidence that conveys the importance of safe consumption sites, preventing overdoses and protecting the well-being of people who use drugs that could bolster the neighborhood group's case if they wish to draw upon it. Today, I am proposing that we, the Board of Health, request our Medical Office of Health provide evidence in support of the legal challenge if requested by the applicant. With that, let's begin our formal discussion on the item. So we do have, I believe, 17 speakers here. So I'm going to ask for a motion to close the speakers list. Moved by Deputy Mayor Morley. All those in favor? Opposed? Carried.
Oh, my apologies. We just need a time in which to close the speakers list.
Close it now.
Okay, so at 1:10.
Yes, thank you. And I'm also going to move a motion to limit speaking time to 3 minutes. I will move that. All those in favor? Opposed? Carried. And for those that are listening online, or those who are here to depute, as you know, we had at the special meeting on December 9th, we had many deputants, many of which I see here today were also here on the 9th as well. And we do have a limited time for this special meeting today, and I'm really afraid that we may lose quorum. So if you do not have to speak, I asking you please not to. And if you do want to speak, please be very brief. If we do lose quorum, then we would lose the opportunity to actually have this passed at the board, and another opportunity will not be given, and it would defeat the purpose of this meeting. So with that in mind, I hope that you take this to heart. And we have heard you, and clearly the board is, I think, in alignment with many of the deputants here. So with that being said, the first speaker on my list is Bida Sinajani. Are you here? Okay, you have 3 minutes. Go ahead.
Thank you. Good afternoon. My name is Bita. I am a Toronto resident.
Sorry, can you hold for a second? Okay, I don't have a timer in front of me, but staff's gonna use the time. Okay, great. Go ahead, Bita. Sorry.
No problem. I'm a Toronto resident and the Community Policy and Network Coordinator at the Canadian Drug Policy Coalition. I want to acknowledge that since our last meeting with this board, there have likely been 100 toxic drug deaths in Ontario, and we continue to mourn the immeasurable loss of our loved ones. Thank you for the opportunity to speak today to provide input on the charter challenge to the Community Care and Recovery Act that is already underway. Given the act would force the closure of 5 sites by March 31st in Toronto, I must emphasize that meaningful action and legal support is needed from this board well in advance of the March 31st deadline. Though the board has previously committed to providing a possible update on a decision on January 20th, we respectfully urge this board to move faster as we anticipate that even January 20th will be too late for meaningful action. We implore you to not leave members of our community fighting for their lives and their rights to health and equality without the unequivocal and timely, meaningful support from this board. As noted in the Health Protection and Promotion Act, the mandate of all boards of health includes the provision of health programs to control infectious disease and injury prevention. Supervised consumption sites are an effective and integral mechanism to further these aims. Toronto Public Health's mission is to protect and improve health at a population level while reducing health inequities. The strategic plan is to create a city where all people can be healthy and thrive, emphasizing a public health approach to prevent and reduce harms from the use of unregulated drugs and to prevent drug toxicity deaths. To deliver on these strategic priorities, it is essential that this board provide evidence on the legal case and take a clear position on this matter, which is in direct alignment with Toronto Public Health's vision and strategic priorities. It is paramount that we see prompt and meaningful action from this board. The board has a responsibility at a minimum to provide evidence in the legal case, and we urge you to take a position. As a national organization, we do not generally debut at local boards. However, on this matter, we must. The precedent that this act sets for the health and well-being of our children and future generations, locally, provincially, and even possibly federally, is deeply troubling, and this board can help change this trajectory. We have 3 recommendations. 1, the Board of Health and the Medical Officer of Health take action in support of the legal challenge by January 10th to avoid further delays of the court proceedings. 2, the Board of Health and Medical Officer of Health take a position regarding the act and make clear to the public the harms to individual and public health and the impacts to the Board of Health's
Your time.
to succeed in its mandate.
Thank you. Any questions for deputant? Seeing none. Thank you. Brett Wolfson Stofko. Again, if you don't have to depute, you don't. I encourage you not to. Go ahead. 3 minutes.
Thank you. So good afternoon. Thank you for the opportunity to speak. My name is Dr. Brett Wolfson-Stofko. I'm a parent, a scientist, and the co-chair of the Toronto Harm Reduction Alliance, and I've worked in harm reduction for nearly 17 years in Toronto and New York City. I've worked at supervised consumption sites, syringe exchanges, homeless shelters, and conducted research on HIV, hepatitis C, and overdose prevention strategies. My opinions are my own and not necessarily those of my employer and funders. I have family who've struggled with addiction, some for over a decade, and lost my uncle to HIV-related complications. I'm here to ask the Board of Health to join the Charter Challenge as an intervener before January 10th, 2025. This law clearly violates Section 7 of the Charter that guarantees the right to life, liberty, and security. Closure of these sites will put people's lives needlessly at risk and is part of the city's mandate and responsibility to protect public health. The law also violates Section 12 of the Charter, stating that people have a right not to be subjected to any cruel or unusual treatment, which this law does by denying people access to life-saving services. There's over 30 years of evidence showing that supervised consumption sites reduce overdose deaths and prevent the spread of HIV. Furthermore, the law is a violation of Section 15 of the Charter that states that people cannot be discriminated against based on a mental disability in which substance use disorder is classified. I currently work for an organization that hosts a supervised consumption site that's near 2 schools and a daycare. We've had over 1,300 injections occur inside the site in the past year. That's 1,300 injections that did not occur on school property, in the community, or in a washroom. Closing the site will almost certainly lead to more public injection and an increase in needles in the community and needlessly endangered children and community members. This site alone has reversed over 70 overdoses, and many of the severe overdoses that occurred would have been fatal if the person was alone in a public washroom or alleyway. There's also more potent substances than fentanyl in Toronto's illicit drug supply. Toronto Drug Checking Service just this past week found that 68% of the fentanyl samples they tested contained methylfentanyl drugs that are 10 times stronger than fentanyl. Closing supervised injection sites now with such an unpredictable and potent supply is a death sentence for people dependent on opioids. Therefore, you must take action now. First, I ask that the Board of Health and Medical Officer of Health take action in support of the legal challenge by January 10th in order to avoid delaying proceedings in court. Second, I ask that the Board of Health and Medical Officer of Health take a position regarding the Community Care and Recovery Act and make clear to the public the harms to individual and public health and the impact to the Board of Health's ability to succeed in its mandate. Lastly, I ask the Board of Health and Medical Officer of Health to invest the necessary resources in order to provide the comprehensive evidence that is required for the courts to make an informed decision. Taking all this and more into consideration, I again request that you take action and join the Charter Challenge as an intervener. Thank you for your time. Mourn the dead, fight like hell for the living. Thank you very much. Questions?
Mr. Chair, you're muted. Sorry. Thanks.
Thank you, Deputy Mayor Morley. Any questions with Deputy? Seeing none, thank you. Calvin Houston, are you here? Okay, seeing none. Marina Klassen, are you here?
Please hold for Calvin.
Okay. We cannot hear you.
I'm unmuted. 1 sec.
No, we have problems hearing you clearly. Okay, we'll go to Marina Klassen. Marina, are you here?
Hi there, can you hear me?
Yes, 3 minutes, go ahead.
So Callum is also here, so I hope we can get him in.
You're muted. Are you talking to?
Yep. So good afternoon, Board of Health. Thank you for the opportunity to speak with you this morning. My name is Marina Clausen. I'm a frontline harm reduction worker, social worker, and community organizer. I've worked in this field for the past 10 years, and you've seen my face a couple of times here. I'm grateful to be back. Thank you for having me. I'm representing for Harm Reduction Advocacy Collective, a strong coalition of neighbors of SES's, people that love people that use drugs, frontline healthcare workers and allies, and so many Toronto citizens. We are your constituents, we're your allies in this fight to protect healthcare delivery. And we have been advocating tirelessly on top of our busy lives and jobs through our grief and our sadness at the mass death due to the toxic drug poisoning crisis to protect harm reduction services. And we anticipate if we do not step in a more active way, the results will be devastating and fatal. So we know how critical this fight is, and we're running out of time. Often it can feel like we're falling on deaf ears when we show up to places and speak about this mass death. But I'm very encouraged that you have called this special emergency meeting before the holidays. It shows some dedication. I appreciate that. We're here today to encourage the Board of Health to join the Charter Challenge to the Community Care and Recovery Act for the health and rights and safety of Toronto citizens. If you take this opportunity to join the challenge, challenging the province, this is not just challenging an unjust law, it's also showing us that you're on our side. As you know, Ford's decision to shut down safe consumption sites, safer supply, and needle exchange services means Toronto communities have less tools available to support themselves. And disproportionately, that includes especially BIPOC folks, Indigenous folks that are gender diverse, women, people that are the most marginalized in our society. Their healthcare is at risk right now. It will be a net loss, not only for those communities, but also for the health and well-being of our entire healthcare system. So we know that it's going to put extreme strain. So Ford's actions to close SESs flies in the face of our protected rights to health. Your responsibility as the Board of Health is to ensure the public health programs and services are delivered to the city in response to local needs. Your role is to reduce inequalities in accessibility of care and improve the health of cities' populations. So I know you care and have compassion for us, but we need to see that in action. We need your leadership and voices more now than ever. We need you to stand up to Ford's government and advocate for the most vulnerable in our communities. So like my colleagues before me, I want to ask that the Board of Health and the Medical Health Officer take action in support of the legal challenge by January 10th in order to avoid delaying proceedings in court. The Board of Health and Medical Health Officer can please take a position regarding the Community Care and Recovery Act and make clear to the public that the harms to individual and public health and the impacts to the Board of Health's ability to succeed in its mandate are at threat. The Board of Health and Medical
Thank
Health
you.
Officer invest in the necessary resources in order to provide the comprehensive evidence that is required in order for the courts to make an
Thank you,
informed
Mary.
decision.
Thank
Thank you very much.
Thank you. We are short on time today, so I do apologize. Any questions from anyone? No. Thank you. Callum Houston, you said he's with you? You want to try again, Callum? Or do you want to pass?
Hello?
Yeah, go ahead. 3 minutes.
So I'm going to keep it really quick because, you've already heard from 3 people already who are experiencing and understand and have explained the consequences of a lack of action by the board. So I'm just going to repeat what Marina was saying because before she was cut off, that I'd like the Board of Health, that we'd all like the Board of Health and the Medical Officer of Health or whoever the acting medical officer of health is, to take action in support of the legal challenge by January 10th in order to avoid delaying proceedings in court. Second, we want the Board of Health and the Medical Officer of Health to take a position regarding the Community Care and Recovery Act and make it clear to the public that the harms to individual and public health and the impacts to the Board of Health's ability to succeed in its mandate are at threat. And we want the Board of Health and the Medical Officer of Health to invest the necessary resources in order to provide the comprehensive evidence that is required in order for the courts to make an informed decision. And lastly, we want the Board of Health and the City of Toronto to have a separate legal case challenging the charter rights that are being infringed on here. The city also, if they took a real stand, they would be doing this as a separate case as well as helping this legal challenge by HIV and the community TNG. That's all that I have to say, but I hope everyone else that's speaking is able to share their story. Thank you.
Yeah, thank you. Any questions for Callum? Saying none. Thank you. Megan White, are you here? Megan White? Okay. Peter Bachman?
Please hold for Megan.
Okay, am I going too fast for the clerk?
Hello.
Yes, go ahead. You have 3 minutes.
Sorry. Okay, there we go. I requested to speak here today on behalf of the many we've lost within our communities. Caitlin, Philip, Emily, Eddie, Michelle, Gregory, Sally, Dan, Kyle, Lexi, Mark, and the list could truly go on. The names should sound familiar as I listed many of them the last time I spoke on this topic. I'll introduce myself again. Hi, I'm Megan. I'm 27 years old and the daughter of someone who uses drugs. I've received countless phone calls informing me that my father has been placed in custody for drug-related charges. He would be released months, even years later at times. Upon his release, despite what the provincial government's approach claims, he was not rejuvenated, healed, or recovered. In fact, each time he returned a little more broken, lost, and feeling more hopeless than ever. The desire to escape from those crushing feelings became unbearable, and shortly after each release followed another phone call, one to inform me of the near-death experience my father experienced. Each of the phone calls, another nightmare almost coming true, another moment I will never forget, another night I will spend screaming into the abyss to please not do something to keep my dad alive, because despite what he has been deemed by society and our government, to me, he was the one to teach me how to ride a bike, how to swim, everything I know about cars. He's lent me a sense of humor that has made the lowest moments of my life bearable. This story is not unique to me. This is the reality for many children growing up. And the 27-year-old woman in me is able to appear here today to state the importance of the Board of Health and the Medical Officer of Health or Acting Medical Officer of Health to support T&G in their charter challenge and to do so before January 10th as to not delay any court proceedings. But the child in me begs the Board of Health and Medical Officer or Acting Medical Officer of Health not to leave the children who fear losing their loved ones out of the conversation. And please don't let my dad die. It's time we choose evidence-based practice over harmful rhetoric and biases. Thank you. Mourn the dead and fight like hell for the living.
Thank you, Megan. Any questions with Megan? Thank you, Megan. Peter Bachman?
My apologies. May I please ask all members participating online to please turn their cameras on to be counted for quorum?
Peter Bachman?
Thank you very much.
Don't see him in the participants list.
Okay. Zoe Dodd? D-O-D-D? Zoe?
She's here. Thank you.
Okay, you have 3 minutes, Zoe. Go ahead.
Okay, thank you very much. My name is Zoe Dodd, and I am a member and a co-organizer of the Toronto Overdose Prevention Society. We are known in Toronto as the group that started the first overdose prevention site in Toronto in Moss Park and in Ontario. And we started because of the toxic drug crisis that was taking the lives of people who use drugs. We tried to warn the city in the mid 2000s about the number of people that will die from deprescribing of Oxycontin. It took a long time for the city to act at that time. We had meetings with the then medical officer of health, Eileen Davila, in 2016. We all gathered. There were 700 deaths in Ontario at that time. Now there's close to 3,000. I am here to urge you to actually fight the legal as a legal challenge. I have not come before you about this issue, but I have been a part of the city and working frontline for over 20 years, including in the majority in the downtown east, and was a part of the Toronto Drug Strategy Implementation Panel for many years. I come to you as an expert as well as someone who works in not only as a research scientist and a community scholar, but as someone who also had to leave frontline work during COVID, as we saw the city pivot to create emergency tables to address COVID-19, but did not implement a table for the toxic drug death crisis, which it has never implemented before. And I'm here actually with a lot of urgency because this matter is increasing. The number of people who will die will be phenomenal. And we know this, we know what it will look like on the streets because we have COVID to look to, and what it looked like when the works had to close for a couple of weeks during COVID-19, and what that was like to be a worker. And I'll tell you what it was like. It was like a horror movie. And I'm not even exaggerating because we were left abandoned to respond to the toxic drug death crisis without any supports. We had to organize people to volunteer, to go outside to help us revive people. This is just one site closing, and there were so many people outside overdosing. And I had to leave frontline work because I saw someone who had overdosed and died in a porta potty be pulled out of that porta potty. And it was at that point a breaking point for me. As a harm reduction worker, workers are in this because they have, a lot of us have lived experience. We have experience with people dying. We also have expertise. And I am concerned about what will happen to people as they also witness the number of people outside. People are using these services for their survival. They're using them every day for the wraparound supports. And it will be more than 5 sites that will close in the city of Toronto. It is the majority of sites that will close and the busiest sites that will close. And so I urge you not only to join the legal fight, but be prepared with an emergency table to address this, because the government has also imposed restrictions around loitering and who can loitering and a complaints process, and they will come for the other sites as well. They've already defunded them, and so it's important and imperative
Thank you,
that
Zoe.
the Board of Health join this legal fight.
Thank you. Any questions for
People's
Zoe?
lives depend on it.
Thank you. Thank you, Zoe. Jonathan Brooke, are you here? You have 3 minutes. Go ahead.
Thank you. Good morning, members. My name is Jonathan Brooke, and I'm both a paramedic and a registered nurse working in the GTA. Thank you for allowing me the opportunity to speak today. I want to address the proposed closure of safe consumption sites in Ontario and share 3 critical points regarding this decision. First, an independent review of safe consumption sites was conducted by the Ontario Ministry of Health. The findings were clear. These sites save lives, are effective in mitigating the harms of the toxic drug crisis. The review recommended not only maintaining these sites, but also expanding resources for them. Instead, the Premier, the Minister of Health, have chosen to ignore this advice and proceed with shutting them down, leaving people who rely on these services with no real alternative. This decision flies in the face of evidence and puts countless lives at risk. Second, as a paramedic, I see firsthand how overdose calls strain our 911 system. Overdose calls are classified as high priority, often Delta or Echo level emergencies, which require an immediate all hands on deck response. Safe consumption sites play a vital role in diverting these 911 calls. When these sites close, the 911 system will inevitably become overloaded, and paramedics will face increased delays in responding to overdoses. This means more people will suffer severe complications because help won't arrive in time. The ripple effects will extend to our already overburdened emergency departments and ICUs, creating a cascading crisis within our healthcare system. Third, the Ontario government has attempted to frame safe consumption sites as something outside the realm of healthcare. This could not be further from the truth. The safe consumption site where I work, we provide nursing-led care, including interventions, education, and support. These are healthcare services delivered with compassion to some of our most vulnerable community members. People who use drugs and may be unhoused are still our neighbors. They deserve the same dignity and access to care as anyone else. Closing these sites disregards this fundamental principle and undermines the progress we've made in creating equitable healthcare. Finally, I want to address the so-called solution of replacing safe consumption sites with heart hubs. While supportive housing is undoubtedly valuable, the limited scope of these hubs is insufficient to address the toxic drug crisis. They do not provide the immediate life-saving interventions that safe consumption sites do. Offering supportive housing while ignoring overdose prevention is like offering a shelter without a door. It doesn't address the full scope of the issue. We meet a lot of folks At the safe consumption site, I meet a lot of folks working as a paramedic who use drugs. I want to share that my experience with the majority of those people are they're just like us. They're human beings. They're not perfect. They have their flaws, but they deserve empathetic care. And most of them, they're hanging on. And I really want to keep supporting them. And I urge you to do the same. I'm requesting, like the rest of the people who spoke before me, the following: that the Board of Health and the Medical Officer of Health take action in support of the legal challenge by January 10th in order to avoid delaying court proceedings. 2, the Board of Health and Medical Officer of Health take a position regarding.
Thank you, Jonathan. Thank you. Any questions for Jonathan?
No, but Mr. Chair, it's come to my awareness that there are reporters who are interested in this session, and they were asking, someone's asking if you could pin the view of the speaker so they can get full screen, and this is for reporting purposes.
Yeah, thank you, Councilor Bravo. I received the same text from the reporters as well, and I did notify staff, and they've mentioned that they're not able to pin the people speaking for a reason.
Okay, thank you. Sorry to interrupt, Mr. Chair.
No worries, no worries. I appreciate you sharing. But if staff is able to pin, please continue to try to do that. I'm going to have my colleague here help with the timer because I see that it's disappeared on my screen here. Emily McMillan, are you here? Emily McMillan?
Hi, yes, I am.
Yeah, 3 minutes. Go ahead.
Okay. Good afternoon, Toronto Board of Health. My name is Emily McMillan. I'm coming to you. I'm coming to the board as a registered nurse, advocate, and a concerned citizen of Toronto. I thank you for the opportunity to speak today and state that while I recognize that the Board of Health has been following the legal challenge against the Community Care Act, that providing a stance of opposition is not enough. It is not enough to voice that an act which is unjustifiable and will undoubtedly be a death sentence to many of my clients is wrong. It is not enough to echo what we know is true, that supervised consumption sites are evidence-based and Ontario's proposed heart hubs are not. We know that supervised consumption sites save lives in addition to decreasing transmission of HIV and Hep C. More so, we know that these are places where our most marginalized communities get treated with empathy and good care. I ask that the board include themselves with the recommendation and that they stand with the medical officer of health, or acting medical officer of health by taking action in support of the legal challenge by January 10th. That they follow the recommendations of speakers today in addition to following the recommendations of the HIV Legal Network. Our city is already facing an insurmountable grief with the current lack of services. The presently operating supervised consumption sites are keeping those alive who come through their doors each day during the hours of operations. However, we lose too many in the time in between. Many voices that hold the power to speak out against the government are silent as the fear of losing the Heart Hub funding is more than the fear of losing the lives lost as a result of these hubs. This is devastating and disgusting. I hope that the city uses their power to support and encourage the community health centers with sites slated to close in forming a coalition to intervene with TNG and the Board of Health on this case. Thank you.
Thank you, Emily. Any questions for Deputant? Seeing none. Next up is Douglas Bellinger. Douglas Bellinger.
Hello.
Yeah, go ahead. You have 3 minutes.
I'm coming to you as today as a community member and a person with lived experience of injecting drugs for over 30 years. I tried going to drug treatment many times, never worked for many reasons. In 2018, I was living rough, got connected to South Riverdale Community Health Center. I tried many times throughout the 15 years to access Hep C treatment, but I was always being judged or stigmatized. The reason why I finally was able to do Hep C treatment was because of the way I was treated by the Hep C nurse. It was with dignity and respect, which these treatment centers do not give you. While doing Hep C treatment, I did their peer training program. When I graduated, I got a job as a community support worker with the Toronto Community Hep C program. I now work full-time as a community health worker and I have not been on ODSP for the last 3 years. I have also worked in a safe injection site, including during COVID. I have seen how they have been able to support people without judgment and connect them to what they need at that moment. I have lost family and friends to the toxic drug supply. The safe injection sites save lives, give people connections to what they are looking for at that time. They give the people using the sites a place to connect to a safe community. The safe injection sites are heart hubs. You cannot force people into treatment. They have to be willing and ready, and until then, we as a community need to support people where they are at in the moment. And from what I've seen and know, even the ones that are ready have an extremely difficult and challenging time getting into a drug or alcohol treatment program. They're always being judged and stigmatized. I know because I've been there many times myself. And I've also made many calls for other people. Treatment only works when you're not forced. You won't understand until you walk a mile in someone else's shoes. Harm reduction works. I ask that the Board of Health and Acting Medical Officer of Health take action in support of the legal challenge by January 10th in order to avoid delaying proceedings in court. I ask the Board of Health and Medical Officer of Health or Acting Medical Officer take a position regarding the Community Care and Recovery Act and make clear to the public that the harms to individuals and public health and the impacts to the Board of Health's ability to succeed in its mandate. I ask the Board of Health and Medical Officer of Health or Acting Officer of Health invest the necessary resources in order to provide the comprehensive evidence that is required in order for the courts to make an informed decision. Thank you very much.
Thank you, Douglas. Any questions for the applicants? Seeing none, thank you. Next up is Kate Dorman. Katie Dorman.
Hello, can you hear me?
Yes, we can. You have 3 minutes. Go ahead.
Thank you for the opportunity to speak. I have the utmost respect for those who spoke before me, and I strongly support their messages and requests. I'm Katie Dorman. I'm a parent of 2 young children and a family doctor at St. Michael's Hospital and an assistant professor at University of Toronto, as well as a community organizer. For the past decade, I have had the privilege of supporting many individuals who use substances and face immense structural barriers to accessing healthcare. I work in close proximity to supervised consumption sites and collaborate with the staff to provide primary care to folks who use the sites. I remember the time before the sites opened, and I am terrified to go back. I am here to ask the Board of Health and the Medical Officer of Health to support the legal challenge related to the Community Care and Recovery Act and to invest the resources required to deliver the evidence necessary for the courts to make an informed decision. The research on supervised consumption services is clear and matches what I see every day. These sites save lives, they decrease infections, they reduce health system strain. I'm sure you're aware of the Lancet study showing the reduction in overdose deaths in the areas surrounding the supervised consumption services in Toronto. The data shows what I see, which is that supervised consumption services make communities safer. Data from the Toronto Police Service supports the fact that supervised consumption services were associated with greater reductions in crime compared to other neighborhoods, and this was demonstrated in Waterloo and Guelph and in the literature. Our health system is facing enormous primary care crisis, and I spend every day fighting to help my patients access the care that they need within a broken system. The strain I feel is truly lessened by the work that supervised consumption staff do, and their work is unparalleled in the system. They offload the burden in our clinics and hospital by administering vaccines, providing wound care, facilitating investigations and treatments. They do this while addressing individuals' basic needs and providing a sense of community. This community is important. The many people I know who started accessing the sites to use drugs now return only for that community health service or to help others. In many cases, I found these networks of support more effective than formal social services. These relationships within the sites underpin people's connection to care, and they cannot be replaced by non-harm reduction-based services. The province's move towards closing the sites, dismantling evidence-based harm reduction programs, and criminalizing homelessness is going to have significant consequences. It's going to lead to more system strain, more human suffering, and more deaths. And the system can't take this. The people in the system can't take this, and the people experiencing it can't take this. Many people I care about are alive today because of supervised consumption services, and many others were lost because they could not access them. Thank you for your time. I hope the Board of Health will take action and join the Charter Challenge as an intervener. Thank you.
Thank you, Katie. Any questions for the deputant? Seeing none, thank you for coming in today. Up next is Jan Houston. Jan Houston, are you here with us?
Hello. Hi.
Hey, we can hear you. You have 3 minutes. Go ahead.
Thank you. Thank you, Chair and Board of Health Directors. My name is Jan Houston, and I'm speaking on behalf of over 25 former Toronto Public Health staff, including retired directors, managers, and frontline workers who wrote to the Board of Health Chair, Medical Officer of Health, and Mayor late last week expressing our serious concerns with Bill 223 and requesting the City of Toronto legally challenge this legislation. I'd like to take this opportunity to read our letter to all Board of Health Directors. As former staff of Toronto Public Health, we're writing to express our concern about the new provincial legislation, Bill 223. This legislation will force the closure of life-saving measures such as supervised consumption services and severely restrict the provision of harm reduction services such as needle exchange. With decades of experience in the field of public health, including harm reduction, it is our opinion that this will result in preventable deaths from overdose and increase the spread of infectious disease and public drug use. Toronto Public Health has been a leader in the development and implementation of evidence-based harm reduction services through the works since 1989 in an effort to save lives and improve the health of Torontonians. We've also worked with and supported community partners to provide these services throughout the city. As the role of the local Board of Health is to provide public health services that meet local needs, including harm reduction, we asked the Board to initiate a separate legal challenge of Bill 223 and specifically Schedule 4 Community Care and Recovery Act, which severely limits and hampers Toronto Public Health from fulfilling their responsibilities under the Provincial Health Protection and Promotion Act and puts the lives of our community members at significant risk. And further, to ask the Medical Officer of Health to report on what measures Toronto Public Health can take to reduce the morbidity and mortality of people who use drugs given this restrictive provincial legislation. We're also appalled by the resulting severe scale back of services at the works and in other agencies across the city due to this legislation, including potential staff layoffs. From our years of experience, we know that the work staff have a wide range of transferable skills that can be adapted to many other programs at Toronto Public Health or in other city divisions. For example, community health officers until recently have been supporting many diverse communities across Toronto since the early 1980s. Harm reduction counselors have a unique skill set, many with lived experience of drug use or homelessness, and have been providing important frontline services to people who use drugs for many years. The city should recognize the skills and expertise of these staff and put every effort into finding alternative employment. In closing, we implore the Board of Health to challenge this misguided provincial legislation and ensure staff of the works can continue to help the city improve the health and well-being of all Torontonians. In the midst of the current toxic drug crisis, please do not let this regressive legislation undo over 30 years of progressive public health policy and practice that has saved countless lives. The letter was signed by 26 retired or former Toronto Public Health staff.
Okay, thank you, Jan. Any questions for the deputant? Seeing none, thank you for coming in today. Monica, are you here? Monica.
May I please ask all members to turn their cameras on just to be counted for quorum, please?
Monica.
Sorry, the speaker is not present.
Okay, thank you. Dr. Sahil Gupta. Can you also reset the timer as well? Sahil Gupta.
I'm just bear with us for a second on the timer. Apologies. Thank you.
It's okay. I'm using it. I have my own. Go ahead, Sahil.
Thanks, board. My name is Sahil Gupta. I'm here speaking to you today as an emergency doctor at St. Michael's Hospital. I'm here as an individual doctor because I'm worried about my patient and the future care that they're going to receive, and we need the board to help to intervene. Every shift that we work in the emergency department, we see people brought in for overdoses. And some nights it can be up to 5 to 6 people impacted from an unpredictable toxic drug supply. I want to lay out what's at stake. Without supervised consumption, people are found too late, which means death or the brain being starved of vital oxygen. The patients we do see need to be seen quickly, and they require several hours of close watch monitoring before they're discharged, often back out to the street in the middle of the night. Consumption sites reduce overdose deaths, and what's fascinating about them is that they do so without the expensive hospital care that me and my colleagues do. And why do they do that? Because they can respond right away. Similar supervised consumption site closures have led to predictable outcomes with increases in opioid-related deaths and ambulance use in those communities. I really do fear that our emerge department will not be able to adjust to these increased numbers, a strain that will contribute to increased wait times for everybody, people who might be injured after cycling or somebody experiencing chest pain, not just people experiencing substance use issues. Overcrowding in our hospital is already intense and it's morally distressing. Most people equate coming to the hospital or to the emerge with long wait times. This announcement worsens care for everybody, not just for people who use drugs. The Board of Health needs to make clear the harms this legislation bring to our city. The board also needs to do so while addressing the contributing issues of poverty and housing in this discussion. Our medical officer of health, the Board of Health, and the city needs to be an intervener in supporting the legal challenge to this legislation. Thank you, and I hope the board can help me, my colleagues, and most importantly, the patients that we serve. Thanks.
Thank you, Sahil. Any questions for the applicant? Seeing none, thank you. We have 3 people left on the list. Daniel Freiheit, are you here? Daniel, 3 minutes, go ahead.
Okay, good to see you again. Most of you know me. My name is Daniel Freiheit. I do a lot of Twittering on the Twitters under the handle Lion Advocacy. I was thrown into the world of public health inadvertently because during COVID, a lot of people started calling me because they were getting fired, remote workers. So it's creating a whole public health issue that wasn't getting much attention and is still not getting much attention. So when I saw a correspondence from Jan Houston on behalf of various retired officials from Toronto Public Health speaking out on this issue of the safe sites closures and what it's going to mean for marginalized members of the community, that caught my attention because I didn't realize this was a channel and option for me to raise awareness about what's happening in the issues that I was facing with people getting injured from the vaccines, some reports of deaths, an area that got very little attention. On this topic, on the issue of safe consumption sites, I think first of all, the legislation is not it was trying to address an issue that a lot of speakers today haven't addressed, and it should be addressed, which is that there's always 2 sides to a public health issue. Meaning, I think a lot of communities what they were seeing on the ground was an increase in the rise of disturbing things on the streets, and some sites were near schools, so kids were being exposed to things. So that has to be addressed as part of the debate, I think, with the safe site closures or restrictions, really. What the legislation does is it moves a lot of the control into the hands of the province rather than the city, because I guess the province was getting more complaints than the city was. I don't know. My point is that we have to hear both sides. You have to open up the floor, get more consultations. I know it's on short notice now with the January 10th deadline, but I think this debate is more nuanced. And I think what you also want to hear from more is folks like Douglas Bélanger, who presented today and talked about his success, not just that he was a lifer going for indeterminately for injections, but that he actually was able to turn his life around. And if we hear more stories like that, then it'll persuade the public that that these sites will work, and that the end game here is not a life of dependency on public health, on going to these sites for more drugs, like that the end of the game here is success and recovery. And again, I didn't know folks can mobilize like this for a cause. I'm glad to see it. I just wish it was I wish it was my cause as well, because I'm still dealing with it. I got 30,000 folks that follow me, primarily from my issues that I've had with how the vaccine was rolled out and how it impacted some people from the community that got nobody's attention. So I'm glad this group has mobilized and keep doing more of it for everybody from different segments of the population. Thank you.
Okay, thank you. Oops, thank you. John Sewell. John Sewell, are you here?
Sorry, just wait for him to unmute. Thank you.
John, can you hear me? I can see you online.
Says okay. Can you hear
Okay.
me now?
Yes, I can. 3 minutes. Go ahead.
Thank you. I've been involved in this issue for 8 years. David Crombie and I, as former mayors, brought together a group of people in 2016, a group of prominent Torontonians, to actually push for the establishment of the first supervised consumption sites in Toronto. That's when Gord Perks and Joe Cressy were working on the issue, and we managed to get them established in Toronto. We are still involved in that issue. David Crombie and I, again, brought together a group of 20 prominent Torontonians, and we had a press release on October the 1st indicating our support for supervised consumption sites. We have now set up a website, which is sitessavelives.ca, which lists most of the interesting, useful information about this matter, most of which I assume you know. And we've also called a public meeting for January 13th in the evening at Trinity St. Paul's Church. And what I would ask you to do is make sure you make a decision today to intervene in the Charter Challenge. That's the first thing I think that the Board of Health should be doing. So you're right on the record of showing where you are. And secondly, getting the projections from staff as to what will happen if these sites are closed down. And they're the two recommendations that I would strongly urge you to make. So please proceed with those two recommendations. Thank you.
Yeah, thank you. Any questions from members? Seeing none. Thank you. And the last person on my list is Nick Carvajal. Nick Carvajal.
Yes, I'm happy to yield my time just to say I support the requests that have been made today, and I'll yield my time for a vote to happen.
The board appreciates that. Thank you very much. We'll now go to questions of staff. Any directors have questions of staff? Deputy Mayor Morley, go ahead.
Thank you, Mr. Chair. I wanted to just get some further clarification on our options here today. I know in the information that was shared, we're looking to direct the medical officer of health acting to provide evidence, but there's a very clear and strong, I think, important call to action for us today to do a bit more than just provide evidence. So if someone from legal can help us understand what are the options before us today, and whether or not we are able to provide direction to whether it's be an intervener, a party to the case, etc. What are the options before us?
Sure. So through the chair, we would have to go in camera to talk about the board's options to participate. We are aware, we heard earlier today that there's a January 10th deadline for notifying the applicants and respondents if there is an interest to intervene. So if the board wants to discuss participating, we can go in camera and talk about that.
I would like to do that, Mr. Chair, if we can. I just had one other question to staff that I think could be done in public, if that's okay.
Yeah, go ahead.
Thank you. The other question that I had, which I think is an important recommendation, regardless of what decision is made about our involvement in the legal case and the court challenge, we are very clear and we understand that there will be an impact to our community and specifically to frontline workers who are supporting the community most impacted here. There was a recommendation around setting up a table around the drug toxicity crisis and holding space for frontline workers and other experts to come together to better support our work and to better support each other. I want to understand if there have been previous conversations or whether staff have undertaken to review the feasibility of such an opportunity or convening such a table.
So through the chair, thank you for the question. I will say this, the board will recall that we have the Our Health, Our City strategy panel, and that does form an opportunity for people to gather and discuss issues of relevance to mental health in the city, and as well the impact of the drug toxicity epidemic. We do have people with lived and living experience who are participants at the table. We do have a number of service providers and broad representation as well of city divisions who are engaged in work that supports people who are living with substance use challenges and with mental health challenges. So there is a very active table chaired well by Deputy Mayor Malik. We have met and will continue to do so in order to support the elements of the strategy and, of course, to deal with issues that are relevant to mental health and substance use challenges in the city.
Thank you so much, Dr. Davila. And through the chair, I'll just really underscore that I think as an important opportunity for us as we continue to navigate the potential impacts of this legislation and holding firm with our community members to continue to honor the values and priorities set out in our health, our city, and making sure that we're holding that space despite whatever is going to be coming down from the province. So I appreciate that. Those are my questions, Mr. Chair, for public, and we'll yield to you until we're able to go into camera.
Yeah.
Thank you.
Thank you, Deputy Mayor Morley. Any further public questions on this item? Okay, seeing none, so we will go in camera.
Please just give us a moment to get the motion ready.
Yes.
Sorry, Mr. Chair, if I may, while they're getting that motion ready to go into camera, I do have one other quick public question, if I may.
Go ahead.
Thank you. On the recommendation that we are looking at in terms of providing evidence, I just wanted to offer an opportunity for a medical officer of health to share with the committee and members of the public as to whether we are in a position to do so and prepared to move forward and provide the appropriate evidence as part of the existing challenges already in place.
So through the chair, you know, as we've indicated several times at the Board of Health and in a number of public venues, there is plenty of evidence that we've put forth in respect of what is required in order to successfully address, or as best as possible address, the existing drug toxicity epidemic. So we certainly have plenty of scientific evidence around the value of harm reduction, what works best in respect of treatment. And of course, this evidence is constantly in evolution and in development. So we are up to speed with what there is to date and are continuing to monitor the development of evidence and the release of new evidence in respect of prevention, harm reduction, and treatment.
Okay.
Thank you.
Thank you. Any further public questions? Seeing none. Is the motion ready? So here we go. Thank you. So directors, we have an item that requires a closed session. I will move a motion for the board to go into closed session on item HL 20.1 as displayed above. I move that. All those in favor? Opposed? Carried. We'll wait for the clerk to secure the room and then we can proceed.
Okay, thank you. We are now moving into closed session. Would everyone who is not needed for the closed session please leave the meeting?
Bear with us one more minute, just giving the live stream a couple seconds to connect. Okay, we've heard the live stream is up and running, recording has resumed, and the webinar is open. Thank you.
Thank you. We're now back in public session. Thank you for joining us at this special Board of Health meeting today. We have received some legal advice in private, which we cannot share with the public. But to the directors, do you have any further questions of staff on this item? If not, we'll move to speakers. First up is Deputy Mayor Morley. Go ahead.
Thank you, Mr. Chair. Through you to colleagues and the public, I do have a motion on this item, and I want to start by thanking all of the deputants who joined us here today and who have been advocating on this issue, not only most recently under threat from this current legislation before us, but over many years and decades to ensure that we as a city have a compassionate harm reduction focused approach to supporting our residents and friends. This is a very personal and sensitive issue, I'm sure, for so many of us. And it's something that we need to, I think, absolutely take with incredible seriousness. The impacts of this legislation are scary. The consequences of this legislation are scary to consider when we contemplate what we're already involved in managing and navigating as the Board of Health and as a Toronto Public Health unit. So I just want to put my motion forward. If clerks could display it, please. I'll just share that, and wanting to really reiterate our commitment as a board, and I hope my colleagues will be supportive of this motion, to continue to use our voices, to share our expertise, and to give direction to our medical officer of health and others, to be strong advocates and strong voices on what's best for our population from the health perspective. So here's a motion to request the city solicitor to advise the applicants and the respondents of the board's potential intention to intervene in the Superior Court application with the court file number there before you by January 10th, which we understand is the deadline. As a child of an addict, I know how difficult this work is, and I know what the impacts are on people in a really real way. We have a responsibility as a municipality and as a board to do everything we can to set ourselves and our community up for success. When we are under threat, we need to band together and we need to get louder and stand stronger together. So I hope that members of the public and advocates and organizers will see that this is the work we are committed to doing. We will continue to engage and do our best work through these challenging times, and we appreciate everyone's participation. The last thing I'll just say on this item is, we sit through a lot of deputations and we deal with a lot of really controversial items at City Council and at the board here of health. And it's very rare that you have every deputant on an issue, coming forward with consensus about what's right, what's wrong, and what we need to do on the go forward. So I'm so grateful for your voices, for your work, and for your advocacy. And I'm happy to put this motion forward to the board. Thank you, Mr. Chair.
Thank you so much, Deputy Mayor Morley. Any further questions from any of, speakers? Any questions on the motion? Seeing none, any speakers on the item in general? Seeing none. I will just speak briefly and say, thank you to all the deputants who've come here time and time again and really just putting their soul and their hearts on the line and sharing their stories with us. We are all moved by it. We feel you, we hear you, and we want to continue to work with you. This is a very serious issue. People's lives are at stake. And part of our responsibility here is to actually save lives and help those who are in need and in crisis. That's why I got into this job as a counselor and a public servant. And I feel compelled to move on this item. As I've mentioned time and time again, I was working in the field for 22 years at the local hospital just down the street. And even today, just walking home, I see some of my former clients and I engage with them and I see the struggles. And I feel there's more that we can do and I can do, and I push the boundaries here in my role as a counselor and even on this board as well. And I hope that I make them proud in the way we're advocating here today still on this particular issue. So, and as Deputy Mayor Morley, said, it's nice to see that we're all speaking with one voice, right? That not one descendant person spoke against this. So that for me is an indication that, we're all doing the right thing here. So with that, I will vote on we'll vote on Councilor Morley's motion first. All those in favor? Opposed? Carried. That's unanimous. As amended, all those in favor? Opposed? Carried. And that's unanimous. Thank you so much. That is the end of our agenda for today. I thank all the board members, directors for coming in today and this short notice. And again, thank you to the public for coming in today as well. I want to wish you a happy holiday with your friends and family and loved ones. And may you find peace. Be well. Thank you.
Thank you, Mr. Chair. Take care, everyone.